We have our last panelist here, Pritam ji. He's going to be asked about what is the role of technology and innovation. We heard Srinivas ji talking about using digital technology for in measurement of various tests that are there. In your view, what can technology be leveraged to deliver services in the primary healthcare system?
Sure, thank you. First of all, it's really my honor and privilege to be here and share the stage with the dignitaries. And I especially have a fanboy moment with the Dr. Velumani. He's been very inspirational figure all the time. Now coming back to the question, see, I'll just try to highlight some of the problems which we have already discussed, most of us, and we all know that there are a lot of things happening at the tertiary care and very few things, as you also mentioned, we need to take these things to the primary healthcare centers or at the bottom of the pyramid where, the maximum problem is there. So if you see India today is very developed nation in terms of technology. We have best of doctors, medical professionals, diagnostic facilities and everything. But even people from abroad are coming to India. But still, if you see the access for basic healthcare for the majority of citizens is a major issue. And it's not only in India, it's a global issue. If you see, during COVID, we all have seen how even developed nations, they got exposed not having a good infrastructure where people can go and do the screening and not having the, proper data also of the healthcare conditions. So that's what we try to focus. Our main objective was to create a solution where, a comprehensive solution where people can come, do the screening, from screening to prescription fulfillment, and then we can move to tertiary care in case the problem is severe. So that's what we try to create. Now, if you see the banking industry, 25 years back, we all had to visit the branch to just do even a minor transaction. Then the ATMs introduced, and today we have a digital payment. But ATMs, these centers really transformed the banking industry also. Earlier, they had to invest huge amount in the CapEx, OpEx, and they also had very limitations to expand and to go to the touch base the extreme rural part. And now with the ATMs, they are at the every corner of the lane, and that makes really even as a user, I'm very comfortable. As a banking, they could expand. So why not bring the similar concept in the healthcare also? And why people just should visit hospitals or big clinics? There should be some small healthcare and wellness centers where we are getting the maximum solutions. It's not just somebody sitting and then again, because if you see India, the rural part, basically we have a major issue of having awareness and the financial capability. We all discuss how it is difficult. Even Dr. Srinivasan was, he mentioned about the Uttarakhand where we could also work at a very extreme the high terrains. And the problem, just to travel 25, 50 kilometers, they take 3 to 4 hours. And that too, if they have a two-wheeler or four-wheeler. And that's the reason, despite of government putting a lot of effort, spending a lot of money, there are many foundations who are trying to do work. There are still majority of citizens who are not getting, the adequate basic facilities. So that's where our approach is, like we try to create, we are trying to work with the government, we are trying to work with the foundations, where we can empower them with the help of technology. And all thanks to the technology, there are many good innovators. The point of care technology has also evolved during, if you see the last decade, it has evolved. And as now we are, fortunately, we can provide these solutions. Many tests, has Sir disrupted the market by bringing the affordability in terms of, the many tests. Now the next stage is we really need to go there and make sure that they are getting everything at their doorstep and they do not have to travel for basic things. Of course, for tertiary care, for hospitalization, yes, they will have to travel till. But at least at primary healthcare center, they should get the maximum facilities. And that's what our main focus was on the diagnostic. Of course, telemedicine is there. Telemedicine is not an innovation, but when it is combined with the diagnostic, so that makes at least a circle complete. And third important aspect is even the data. So that is also, we'll surely talk about it. But these are the three main elements where we are working on. Thank you.
Thank you, Pritam ji. I'll be asking 3 quick questions to the panelists where they will all be contributing. But before that, my appeal to the younger generation especially is, I don't think you should be trying to replace doctor.
You mentioned that technology is not to replace anyone. It is basically to empower all the medical professional and every individual. Now, secondly, the people who are actually serving the people in the healthcare, why we should just put a lot of pressure on them. We really need to change the culture, and we really need to change the thought process from diagnostic only from the treatment-based criteria to prevention-based practice as well. And we really need to change this as a practice, as a regular. In fact, I would request Modi ji if he could start this beautiful mission like Swachh India, Swachh Bharat Abhiyan. If we can start something like Swasth Bharat Abhiyan, like every individual should take the important, I mean, there should be awareness, he should be able to understand how important his health is, which is ultimately going to contribute to the nation itself as a community. But at the same time, there should be enough access point also. Just having awareness, I mean, okay, fine, I'm aware, I have some money, but I don't have that easy access point where I can just go and do random checks. Not only when I'm suffering, but even as sir said, like there are so many people having a diabetic issue, and there are so many people who are sitting on that other side of fence where they are pre-diabetic. If we can identify not only diabetes, as you mentioned, other diseases also, simple like blood pressure, diabetes, cholesterol, if we can identify these things at the right time, so I think we can even reduce the burden on the hospitalization. I mean, there are so many people who are in the waiting list and everything. I think we can reduce that. And that is one of the reasons even our solution name is Swayam. Why can't we start from our own? I mean, let's do it from our own. That's it.
Dr. Velumani?
We request all the panel members to pose for a group photograph.